listeners to another episode of our In the Hot Seat panel discussions, where we're going to cover technology trends that we're seeing in today's industries. These panels are part of the Discover Opportunities initiative here at ScanSource. My name is Kyle DeWitt. I'm the Vice President of Technical Services. And today I'm joined by 5 of our supplier partners who are going to help you, our mutual customers, discover opportunities in the healthcare space. This is one of 3 panel discussions we have on healthcare. Today, we're going to have a theme with our panelists on the new inpatient care in hospitals. Our other panel discussions have been on remote healthcare, have been on digitization of healthcare, and so we invite you to view those panels to get the full story around what is happening in healthcare right now. And obviously, I welcome our 5 guests today to touch on those points as well, because you get bonus points, in my view, for creating continuity in our panel discussions. So I'm going to start and go round table here and let each one of our panelists introduce themselves. And being a Southern gentleman, I will start ladies first with Phoebe.
Thanks, Kyle. Thanks, ScanSource, for having me. So I'm Phoebe Cresswell. I am the Senior Healthcare Customer Marketing Manager at Honeywell. So looking forward to the discussion today.
Thank you, Phoebe. And to create continuity immediately, we're going to go to Marcelo, who both Phoebe and Marcelo are both prior ScanSource employees. Marcelo?
Hi, yes. Marcelo Munoz, Channel Partner Executive here at Star Micronics. Been with the company for about 8 years. And, we've had some great experiences with ScanSource, developing, partnerships, relationships, and we thank everybody that's watching this for that, and also looking forward to today's panel.
Yep, great. Thank you, Marcelo. Jeff, I don't have a cool reason to come to you next. You're just on my screen next. That's the coolest reason.
Well, thanks, Kyle. I appreciate that. So Jeff Fontaine, I lead Elo's healthcare business here in the U.S. as well as in Europe. So certainly look forward to this discussion and the chance to talk healthcare with our partners.
Thank you, Jeff. Lou, we'll come to you next.
Thank you, Kyle, and thank you, ScanSource. I'm Lou Gallagher with Mitel. I'm a consumer engagement specialist specializing in healthcare for Mitel.
Thank you. And audience members, Lou joined us about 30 minutes ago. So we're all super excited to see how well he handles this. I know he's going to do great. Rustin, you're last one to do introductions here.
Awesome. Thank you, Kyle. Looking forward to this. My name is Rustin Bourbeau. I'm the account sales manager for SpectraLink. We've been around about 30 years, and I happen to live in North Carolina and work the Mid-Atlantic region, but looking forward to discussion today.
Great. All right. So thank you to all 5 of you for your time today. Again, as I teed it up at the beginning, our audience here is our mutual customers, ScanSource partners, and we're really excited to hear from you 5 on what you and your companies are seeing as trends in healthcare space that technology can solve. Again, hopefully with the takeaway that our partners can start to identify what those opportunities are and know what resources they have available to go cash in on them. So we will start again today. Our theme is the evolution of inpatient care within a hospital system as an example. But as I've mentioned, we've done a whole panel on remote healthcare and digitization, EMR, EHR, those types of things. But we still do, despite the pandemic and despite the current challenges, we still do have patients that choose to go into a facility, a healthcare facility, or are forced to because it's critical care. And so we are seeing quite a digital transformation happening in that space, or in this space also, not just in remote healthcare, but also for inpatient healthcare. So I'm going to bring our first question to Phoebe and to Lou. And Phoebe, I'll start with you and get your thoughts first, and Lou, I'll come to you after that. So given that we're evolving inpatient care and that our patients have a choice of where they receive their care, where are you seeing technology being deployed to improve that inpatient care experience?
Yeah, so I can take that. Thanks, Kyle. So at Honeywell, this really means mobility to us and to healthcare providers. So providers are faced with how do they bring care to patients, how the format that they want. So we've obviously seen a big boom in telemedicine for those patients who maybe are still a little hesitant about going into a facility, but still need to keep up their regular care. So that's been a big development, a big evolvement that we've seen. But then when you get back into the hospital as well, so the care that you can't put off, you have to be there. Being able to really have a mobile staff, so all of your clinicians having a mobility device in the palm of their hands, you can bring that care to patients right in their room. So having that mobile technology, being able for your staff to be more interactive with their patients, gives them a better experience. And it also creates a lot of efficiencies for your staff who's managing that. So mobility is really where we're seeing inpatient care and just seeing the boom in technology as well.
Yeah, thank you. Lou, same question for you.
Yeah, Kyle, that's a great question. And we really look back into, how is healthcare competing against other industries? So you look at like a retail experience, patients are really looking for that retail experience in their healthcare provider. Unfortunately, with healthcare, I spent the last 18 years of my career in the healthcare industry and building these types of environments out. And one of the biggest challenges is we have to do a cradle to grave for our patients. So our patients don't always have the same need. Like in a retail, I buy a product, it's a one-to-one relationship. Even as a patient, we have many different needs from our healthcare providers. So what we've seen is a retail experience or a build out of a back-end ecosystem where we take all types of communications, integrate them together so we can have a much more consistent experience for our patients, regardless of the type of service that they're going to want, whether it's remote or inpatient or clinic or outpatient or labs or anything, and bring that together and then communicate that, as Phoebe was just saying, the way the patient wants to be communicated with, whether that be a text message, a voicemail message, a chat, and bring that all together into one seamless interaction.
That's great. You're already creating continuity for me, Lou. I appreciate it. We have talked. We did a similar panel on the retail experience, and one of the takeaways from that was, even though we're talking about retail, that's even a healthcare environment now with the amount of cleaning and social distancing and all the things. So one of our panelists said that we're all in healthcare now, regardless of what our industries are. So. And the other key point I hear there from both of you is, and I mentioned it at the top, but patients now have a choice on where they receive their healthcare. So this is a competitive business now. It's not just about being physically located near your patients as much as it is that your quality of care, your customer experience, CX in healthcare. Seriously, it's relevant for sure. So thank you guys for that. So I'm going to come here to Rustin and to Jeff with this next question, just looking at that, the return to primary care in a physical facility. Even despite that happening, we still do have separation between the healthcare provider themselves, the staff, and the patient, be it even if they're in the same facility or bringing in a specialist remotely. As Phoebe mentioned, just kind of as part of a mobility solution in providing healthcare. So what are you guys seeing that facilities are doing to ensure that we've got enough separation between provider and patient, and when that's done, that it doesn't impact the ability to deliver healthcare? Jeff, I'll start with you on this one, and Rustin, I'll come to you right after.
Yeah, Kyle, thank you. There's a couple of things that I would really share in that context. First is this concept of virtual health and really enabling the provider side of the equation. So we hear so much talk about the patient experience, what we've just discussed. There's also this idea of how do we enable the provider? And I think there's a really great example that came out of the state of Florida where you had a children's hospital and they were evaluating how they could provide care really across the entire state of Florida and leverage some of the domain expertise that they have in pediatrics for children and physicians all across the state, from rural to other urban communities. And so today we're looking at how can they enable their providers with technology to address virtual sessions. So a great example is a pediatric cardiologist who's got some real domain expertise. How do we take that individual and share them across the entire state of Florida? And this children's hospital looked at different technologies that could enable that, right? So concept of this pediatric cardiologist comes out of a surgical procedure, can grab a cart with a display and a camera similar to the session we're having here, and really have a conversation with a patient, patient family members, a physician, no matter where it was in the state of Florida, and give some expertise about the patient condition, maybe treatment plans, things that they should be looking for. And so I think a number of healthcare facilities all across the country are asking this question: how can we arm and enable our providers to be more effective in the care that they can deliver, whether it's in that physical facility or it's in that sort of virtual session across the state, across the country, and we're even seeing things now around the world. So I think that's an exciting opportunity for partners here, is to understand it's the patient side of the equation, but there's also this provider side of the equation that the technologies can really address.
Great. You're setting me up to ask my how do we acquire the right talent question here in just a minute too, because there's an element to that from a provider standpoint. Rustin, want to get your thoughts on this too?
Yeah, I mean, we're all knowing and understanding the same difficulties from a patient or from a clinician working with patients in a hospital, and the information they require to help validate that the right medications or access history. So all of these solutions that are within technology and applications that are available now really provide the clinicians, the users to gain that and access that information right away. We talk about mobile devices in the hands of the clinicians that also offer scanning capability or pictures for wound care to then push and pull and out of EHR systems. So you have the access at your literal fingertip to be able to really provide better care and be in front of the patient more, as opposed to having to walk out of the room, get with somebody else. You can have teams of people, groups all tied into these applications, and right away you're able to collaborate internally about that patient and give better care.
Speaking of at your fingertips, I'm coming to you, Marcelo. One pun down. The second pun is I appreciate your patience in being the fifth speaker here. You can't go through a healthcare panel without dropping a patience pun. So Marcelo and Jeff, your companies both have are specialized in touch products, and Rustin just mentioned literally having patient records at your fingertips, but self-service kiosks, self-check-in, things like that are also very relevant in today's space. So how easy do you find it for partners to deploy those types of solutions? Again, if this is a new opportunity for a customer that isn't in this space, we want to make it easy to enter, right? But Marcelo, we'll start with you. Just let's talk a little bit about self-service options, including self-check-in kiosks.
We definitely see a huge potential here in healthcare. You know, we've talked in the recent past about, you know, how in retail self-service kiosk, you know, was starting to see some growth before pandemic. Now, you know, we're in this area that we're coming out, but we've gotten used to the, you know, the virtual visits, and people still kind of iffy on, you know, being in a waiting room for X amount of time. So when it comes to self-service kiosk, from a medical perspective, whether it's your general practitioner, a specialist, hospital, wherever you're going to go, there's definitely opportunities for that. You know, pre-registering your visit, you know, cloud I'll mention it probably for the majority of my talking time. The cloud technology is really at the core of it. So from your phone, you connect to, if it's, in my case, Baptist Hospital, their network here in Miami is huge. So, and they share information between offices. So that's another one of those customer experiences that you alluded to earlier. It's very important. That keeps me going back to Baptist because I don't have to repeat forms or anything like that when I go visit. So when it comes to the kiosk, you put in your information, if you have any symptoms, if you're sick, the reason why you're going, the doctor, to kind of get everything set up so that when you actually get to the kiosk itself, you're just really checking in. You can even check in by mirroring that kiosk if you don't want to touch the touchless screen that's there. Get your printout, from that, kiosk, and you'll be ready to turn in and see your doctor as soon as possible. So yes, even temperature stations, when you're going into the hospital or you're going into any medical facility or clinic space, that's also another opportunity for a kiosk that we're starting to see. So they read your temperature, you're good. You get a sticky paper with different colors for representing each day, and you're good to go. So it's so many more layers, much more opportunity to get into this business with self-service kiosk. Tablet-based, definitely, for saving space is the way to go. So yes, can't say enough about that. We'll definitely see much more opportunities grow as the culture evolves and continues to keep that safe and clean environment going.
Yeah, I love the correlation you made between retail and healthcare. Again, it's another one of our little sub themes here, but just like people take a consumer experience into the enterprise and expect to have that same experience in the enterprise, or you're starting to see again, patients have a retail experience expectation when they receive healthcare. Jeff, we'll come to you. Same question. What's Elo seeing?
Well, certainly, Elo is passionate about self-service, right? Our solutions from a kiosk perspective are ideal for this environment. And I see tremendous growth potential for our partners, both from a hardware delivery, but also a service side expectation to enable these healthcare providers to stand these solutions up, right? If you think about a hospital system where they may have upwards of several hundred locations, and the idea of being able to stand up that solution across all of those various locations, that represents a service side opportunity for our partners. And one of the things I see from a self-service is what I refer to as this mobile to in-person to mobile experience. From a mobile perspective, we're seeing a number of pre-registration opportunities. So I can take my smartphone, I can register, I can add some demographic information, some insurance verification data, potentially even looking to complete a payment right there through my smartphone. But once I'm in that facility, it's the concept of presenting. And then maybe there's a QR code on my phone. I present that to the Elo self-service station. That can scan that barcode. We snap to sort of the consent form or a process that wasn't necessary to complete it. And then I've notified that facility that I'm there and I'm ready to receive care. Then subsequently, we can transition back into a mobile experience where we now can disseminate information, whether it's that payment receipts, that's insurance information, or it's even sort of discharge instructions back to that mobile phone so that patient can really take ownership of their care in that process. So we definitely see tremendous potential with self-service, helping hospital systems deploy this, stand it up. And the last comment I'll make is the value to the health system is the redeployment of resources, right? So it's not necessarily taking that registrar individual and eliminating that headcount, but let's move that headcount into higher value tasks. Let's make sure that appointments are met. Patients can have access to transportation. So there's a number of things hospitals are thinking in terms of moving folks into these higher value tasks from a headcount perspective, which may speak to your talent and your retention conversations later on.
Yep, that's coming up right now. We're headed right to the communication suppliers here to talk about that. Before I do that, I don't know why I created this habit, but I've started giving gold stars out in panels as if we're children. Jeff gets the gold star for bringing services into this. That's my passion, right? So Lou and Rustin, as Jeff just alluded to, coming to you guys to get a communications view into how staff communicate, both internally and externally. Marcelo and others have mentioned, accessing the right talent, regardless of where the talent is. But like I mentioned earlier, talent acquisition in a competitive space like healthcare now is critical. Is critical to customer experience, to CX. So as Mitel, SpectraLink, firmly entrenched in the communications space, you guys probably have a great amount of insight here into how these healthcare providers, how hospitals are using communications to stay in touch with patients, staff, et cetera. Rustin, I'll start with you. Anything that you're seeing that's innovative, new uses of the technology? Again, opportunities for our partners to get into that space.
Yeah, absolutely. Thank you, Kyle. Over the past 5 years or so, moving from seeing applications that might help a clinical user to gain and access information on a BYOD device, which is horrible, in my opinion, to a hospital, purpose-built device that would be secured and all the things that need to be from a HIPAA compliant and some of the things you'd be concerned about. Application companies so many are out there that are doing collaboration applications, and the collaboration is both within the teams that are involved in patient care and also the access of information back to the patient's information via EHR, alarm management, tying into to nurse call systems or to patient monitors that provide direct information about how the patient is doing while in the hospital. All of those provide information to the caregivers that then they can get back to the right teams of people or person that needs to be engaged in that particular incident. Technology is allowed now, and it's in every hospital. I talk to no one right now in a hospital that is not looking at some type of application or access of information via an application. All of them require smart devices. All of that needs to be secured. As the infrastructure is built out now. Years ago, it was overhead paging, and then it was pagers. All those were proprietary systems. Now everything is over their internet and has to be secured. All that information now is being accessed over their Wi-Fi, over their Wi-Fi infrastructure, and it needs to be secured. That is being done across the board within healthcare, and it's important. So.
Yeah, I'll piggyback on what Rustin was saying. I mean, I'll just continue the conversation. So you look at healthcare, there's still actually some healthcare organizations where the physicians carry pagers. And we're having to move them out because if you think about pagers, that's an asynchronous or non-real-time communication. And that is not what healthcare needs today. We need to have communications between physicians and the caregiving staff and the patients. And Rustin hit it on the head, is take the EHR information and bring that into a communications mentality where we can integrate a text message out to all caregivers on a team for a specific patient, for a specific ailment or appointment type. We can take that type of communication and bring it in now to how we communicate with patients. If you think about it, a lot of appointment reminders, we are working on 15 different replacements appointment reminders right now where, when I order my pizza and I call my pizza place, they know who I am and what kind of pizza, but my healthcare company sends me a generic message a week before and it has nothing to do with my appointment type. We can now give patient preferred method of contact, right? PMC, out in real time to a patient via text, via a voice, via an email, where they can respond back to us and say, yes, I am going to make the appointment, or no, I'm not. I need to speak to somebody that can help me reschedule. Another way we're using the communications, and Jeff hit on this a little bit, is that in-person, non-in-person interaction with the patient. When we do have a patient coming, let's say for an outpatient visit, we've got one clinic now that when the patient's arriving at the outpatient location, they send a text to a scheduling that says, hey, I'm here at the office. It gets automatically sent back to the patient saying, wait until we tell you to go to which room you're going to be assigned, a virtual waiting room for them. The physician is notified at that time as well. So the physician knows that their next appointment is arriving. when the physician and the room open up, it is automatically sent to the physician, the patient, and the central scheduler to say, the room is ready, you can now enter.
Yeah, that's a much better experience than most of us have today.
Yes.
Yesterday with just clinical visits, that lots of paperwork, lots of shared pens, lots of waiting in rooms. So yeah, I'm geeking out on it, Lou. My background's in communications too, and you and Jeff are speaking my language. So Phoebe and Marcelo, we're going to close out with you guys today. Just kind of last question. I've heard a lot about mobility. Sometimes bring your own device, sometimes not. But there's obviously an inventory of product that healthcare providers are using to deliver healthcare. Be it scanners, mobile devices, carts. Phoebe, you mentioned carts earlier, but in what ways are our healthcare providers now leveraging technology to make sure they can track all those assets and they know where they are? Phoebe, I'll start with you. It's been a while since I've heard from you today. Sorry about that.
No, not a problem. So asset tracking, Honeywell is passionate about this, and it's several different ways. So you're right. You need a data capture device, whether it's in the simple form of a scanner, or if you're utilizing that mobility device to track assets throughout a healthcare system. But then even taking a step back, and I'd say a good opportunity for our partner community to look at is also that tracking of how the assets get to the hospital in the first place. So making sure that, especially in today's world and what we've seen the pandemic do, even taking that back to the supply chain of your healthcare customers and their organization. So it's making sure that we're able to track from the very beginning, from that supply chain of actually receiving in all of your assets and all of your materials that then you have to track once they get into your organization. So technology plays a big part in this. We don't ever want to see a healthcare provider who's still having to manually track with a clipboard and paper. There's so many advancements in the marketplace, so many data capture devices to help them optimize their asset tracking. And even at Honeywell, I'd say we take it a step further of not just tracking and helping healthcare providers track their materials, but we also now have ways that we can help healthcare providers track their technology devices and track their equipment. So looking at how their staff is utilizing their technology, how is it functioning for them? So there's a lot of opportunity around asset tracking, starting from supply chain all the way through the facility, all the way to the staff.
Yeah, there's a big data element to that too, right? So there's some data analytics in there. Marcella,
Lots of data.
Yep, closing us out today.
All right. Well, some great points made by Phoebe. Technology definitely has a lot to do with it. I go back to, cloud technology and using these applications in conjunction with either scanning a QR code, RFID tag, depending on, there's different budgets for different types of hospitals, different type of clinics, right? Not everybody can afford that huge robot stroming the halls, scanning for RFID tags, right? You can get away with some of the stuff just by scanning a QR code, having some type of printing device there to identify it, label it with a QR code or an RFID chip, and have all that managed up in the cloud. We talked earlier about security and how important it is to have that data protected. There's a lot of sensitive information and a lot of expensive information if you're tracking, devices in a hospital, or something goes out for repair, or an MRI scanner or something. You definitely want to be able to keep tabs on it at all times. So data management, I think, with cloud applications that can be easily transmitted from the cloud to any mobile device in anybody's hands, really. You can create groups and whatnot, doctors, maintenance, etc., the nurses, kind of separate the departments from that standpoint. But yeah, definitely make it streamlined, easy, achievable, and scalable to the need of that particular facility, I think is important. The great news is that there's so much technology, so many options, so much creativity now. At the onset of all this, it's been a boom, which we dubbed the digital revolution. And it's great to see that, hospitals have definitely adapted to it, medical facilities that have adapted to it and have made that experience so much better for everybody involved, whether it's the patient or that healthcare worker. That's at the core of the whole thing. So to close it out, yes, asset management is very easily attained. Really, it's the creativity of those developers, of those partners that are trying to put solutions together. There's a lot of options for that.
Yeah, I think that's a great takeaway there, Marcelo. I appreciate the closing comments there, because I think if you look at the areas that we have all made our careers, scanning, printing, communications, those aren't new technologies. They're just being adapted in new and creative ways. So again, there's a lot of expertise here. There's a lot of expertise on my team at ScanSource that can help our partners navigate all this. I think Phoebe got this close to saying blockchain. Like, I thought she was going to say it. She didn't say it. She was super close, but that's another opportunity. Big data is an opportunity. Security is an opportunity. Again, a callback to our digitization of healthcare panel. We talked about the security elements and having to secure all this data now that it's on your device. So lots and lots of opportunity out there for our customers. I think the most tangible opportunity I took away from this is walk into a healthcare facility, and if you see pagers, you got a sale right there. Like, that's such archaic technology. I didn't even think about it until you said it. That's my wife's guilty pleasure. She just binge watches anything that's a medical drama. And still today, 2021, people are pulling pagers off their belts and looking at them. So again, thank you, Jeff, Marcelo, Phoebe, Lou, and Rustin for joining me today for our panel. Again, our partners, this messaging is for you guys. There's a lot more of this you can find out on our page, which is scansource.com/healthcare program. You'll find links to the other panel discussions we have, plus a lot of other assets that we've created for you to help you discover opportunities in this space. So with that, I will thank our panelists one more time, and we'll sign off.